Hello, I'm Dr. Ann Clark, CEO of ACI Specialty Benefits, and our guest today is Dr. Sonya Norman, an expert in PTSD, a very popular topic in the media just now. Sonya, could you give us a very simple definition of PTSD?
Absolutely. PTSD, or post-traumatic stress disorder, can happen to someone who's been through a traumatic event, something out of the scope of normal everyday experiences where they think they might die, or they almost die, or witness someone else getting very hurt. And most of us, after an experience like that, would be very upset, and then we kind of move on. PTSD is not recovering naturally after an event like that.
Not recovering naturally. And mostly I hear this term applied to veterans returning from war, which of course would be traumatic.
Yes.
Do all veterans have this?
No, absolutely not. In fact, shortly after combat, it's something like maybe 20 to 30% might have it, or have the symptoms of it. And it can happen to anyone because of the nature of combat. It is common in people who've served in wars, but it can happen to any civilian.
So the recent tragedy at Aurora might have some victims who suffered PTSD.
Oh, absolutely. That would be a perfect example of a traumatic event happening in a civilian setting.
Mm-hmm. Now, tell us, you describe this disease, this disorder, as someone not recovering, and is this somewhat hidden, or is it very obvious? Are these victims violent, or would we expect to just be your next door neighbor?
I'm so glad you raised that point because of some high-profile media cases, and there's some myths right now that PTSD is linked with violence. And in fact, it's a very complicated story of what might make someone violent or aggressive, but PTSD alone does not cause that. And in fact, if it did, it would be a symptom of the disorder. There are disorders where aggression and violent behavior is actually a symptom to have the diagnosis, and that's not the case with PTSD. A very large number of factors, including drug abuse, maybe brain injuries, past violence, might put someone at risk for being violent, but PTSD alone does not.
Okay.
So that's a very important
So
thing
we
to
can
clarify.
clear that up
So
for
glad you
our
asked.
listeners and viewers. A returning veteran has access to the GI Bill, and often they choose to go back to school. How can a school, that is the professors, the staff, the advisors, how can they recognize someone who might need help? Someone who perhaps is an older student. What signs and symptoms might the ordinary person notice?
If someone's, of course, struggling with their coursework, or seeming to have concentration problems, or is irritable, or having a hard time focusing, or seems sleep deprived, those might be some signs that someone's struggling. But there's also just a broader issue of anyone who's been in the military, and then especially in a combat zone, coming home is just such a huge adjustment. What seems so easy to be in a city in the United States,
Mm-hmm.
or it's such a major adjustment for someone who's been in that kind of, having that kind of experience. And there's so much campuses can do to just help a veteran feel welcome and help a veteran readjust back into the civilian world. And often going to school is a veteran's first real contact outside of family, friends, the very close community with the civilian world. So it's a great opportunity to welcome someone home and to help that be a positive experience.
So they're adjusting to civilian life again, and now they're adjusting to campus life, where the students might be a little younger, might not have families or as many obligations as a veteran has.
Exactly.
But the point is to welcome the veteran home. What would that look like?
That's a great question, and it really can vary. But some examples might be simple things like having flags around the campus, American flags, having a veteran group on campus, and giving them resources.
So a support group would be a good idea to advertise it.
Yeah, I would say even just a social group, something fun,
A social
where the veterans can feel connected with each other. if there are services that the veterans are using a lot, like Veterans for Struggling might be using disability services, either because of a brain injury or PTSD or whatever reason, having some veteran staff. Some campuses have set up kind of not a Big Brother program, but something where there's a veteran who's been there a while who kind of is linked with a veteran who's just starting to help them, show them the ropes or show her the ropes.
The student assistance program on campus or employee assistance programs in the workplace could help with more posters, more brochures, picturing veterans, giving a visual to the veterans so that the materials seem welcoming.
Absolutely.
That would be part of it. And support groups, connecting to them to counseling, is that a good idea?
Absolutely. Anything that, sends the message that it's acceptable to go to counseling, that there's no stigma attached, that it's okay to ask for help, that this is a community where, that's appreciated and welcomed is great.
The families must struggle also. They too are adjusting to maybe having the father or the mother come back after a period of time. Aunts, uncles, grandparents may find it hard to adjust to this more mature, more experienced person coming back. What would you say to family members?
Certainly no one comes back from an experience like war the same, and so to kind of give the family that space to readjust, reacquaint themselves, not expect things to kind of pick up where they left off. And certainly the person who managed the household on their own for, several months, maybe a year, has probably grown and changed as well from that experience.
So it's not just the veteran or the person who's been in a traumatic experience, the family is no longer the same.
Yeah.
So the two environments have to mesh somehow. And just as a commercial message, I might remind our viewers and listeners that the student assistance programs and the employee assistance programs provide service to all family members, and we're very loose about what a family member is. So that could be a roommate, a partner.
That's great.
It's all are eligible for this. So what kinds of specific academic behaviors? You mentioned concentration and memory. Can you say a little more about what a professor or a teaching assistant might expect?
Sure. You might expect that it is hard for them to sit through a whole class. If you think about, that isn't a kind of behavior or part of their brain they've had to use for several years in their military jobs. And so that might be particularly hard for someone who's either physically injured and has some pain or has some concentration difficulties, which is a symptom of PTSD, depression, a brain injury, a number of things that could happen after combat. So encouraging things like, taking breaks, making it acceptable for someone to maybe stand up if they need to in the back of the room, making it acceptable to bring recording devices for someone who's having concentration difficulties, or recording the lecture and making that available online. All of those kinds of things can be really helpful for someone who's struggling to sit with a class. The other thing I hear a lot from people who are struggling with PTSD is irritability. Violence and aggression are not a symptom, but irritability is. And they're used to a lot of order, and people are very disciplined in the military, of course. They have to be to survive. And it's very irritating for people at times when they come back and there's people coming in late to class and walking in and out and checking their email. And they kind of have a hard time with that.
So
sometimes.
A college classroom might seem undisciplined and disordered and somewhat even chaotic.
Yes, and that's all part of that readjustment. So, that's all part of that reintegrating and sort of getting used to the way things work in the civilian world. But that can be a challenge.
Irritability, speaking as a former college professor, I found often my student body was pretty irritating to me. So you would say this would be something where a professor might observe this behavior and perhaps meet privately with a student and offer some options like a break from class, or like, as you say, bringing recording devices, maybe referring them to campus resources for counseling.
Yeah, and I really like how you noted the kind of meet privately, because I have heard from veterans that at times they felt singled out in classes or sort of made the center of attention when someone's referenced their veteran status, and especially if they feel that it's not a campus that's very supportive of veterans or where the student body really understands what they've been through, they don't necessarily appreciate that attention.
Mm-hmm.
So I think the kind of, saying, hey, I noticed, sometimes you seem distracted, is there anything I can do?
Mm-hmm.
I think that after class is a
privacy and not singling the student out would be very, very important.
I think so.
Grades would probably be an indicator too. If a student comes in and seems enthusiastic in the beginning but isn't quite making the grade, would that be part of this picture?
Mm-hmm. Mm-hmm. Yeah, that could definitely be a sign that someone's having a harder time than they might be showing otherwise. Something I'd like to highlight is just how many strengths the veterans bring to campuses and how much they contribute to a campus culture, and that a lot of the veterans I speak with, they may have their struggles, but they're the ones in the front row with their hand up because they really appreciate this opportunity. They might be a little older, they have a little more life experience, and they're really appreciative that they have this chance to get a degree, get their life going in a direction they're really excited about, and they can just be so enthusiastic, and so I think any service that they're offered can be very appreciated.
So rather than just talking today about weaknesses and difficult problems that a veteran might have, we also want to talk about strengths. They bring a lot of experience, perhaps maturity, enthusiasm, perhaps gratitude for the opportunities that the government and the states offer, and focusing on the positives is a very important part of veteran services.
Yeah, absolutely, and I think as veterans feel appreciated for what they're contributing to the campus, that makes them feel at home as well.
Thank you so much, Dr. Norman.